We are here with the second question for Professor Vincent. That one will be, I think, very relevant for our discipline. Why a young doctor should choose intensive care?
I suppose it's the same reasons as for why I did intensive care medicine. And the first one is that I like to look at the patient as a whole. I like to take care of all the organs and above all, the personality of our patient. The second element, in critical care medicine, things change rather quickly. And especially when you change something in the immediate management of the patient, when you turn the PEEP knob, you will see something happen when you increase the PEEP level. Likewise, when you increase the dobutamine level, you will see a change. If you don't know how the patient will respond, you do a challenge like a fluid challenge or a dobutamine challenge, and you evaluate how the patient responds. And that's something I love personally. And you are dealing indeed with very severely ill patients. So you can feel that your intervention can make a change. And that's another very important element in our discipline. Without us, the patient would have probably died. I'm sorry, but that's the way it is. So if the patient eventually dies, we can think that it would have been the case without us. We did our best, but we did not succeed. So it should not really take a negative influence on you, not at all. It's a great privilege to take care of patients who are really very ill.
Of course, you mentioned a lot of these medical qualities that an intensivist should have, a global view of the patient. But especially with the COVID-19, as an intensivist, we had also to show many human qualities. Which are those which are really relevant for our career too?
That's exactly what I wanted to come to. And before that, I would insist on the team approach. We are really a very interactive life at the bedside among doctors, with nurses, with physiotherapists, with pharmacists and other members of the team. In intensive care medicine, you cannot be alone. And when I usually say that the patient is at the center of our preoccupations, indeed, I put the family there too. And so the humane factors, of course, are centered around the patient, but the relatives are really part of the team at the bedside, and we must count on them. We must integrate them. We should not tell them stories. We should tell them the truth, and they will quickly understand that we are doing our best for their loved one.